Good morning, everyone. We're here to tell you about the WellHome project, but first, some introductions. I'm Frank Kelly, and I'm Professor of Community Health and Policy at Imperial College. And two of my colleagues are here, Dr. Diana Varaden and Dr. David Green. And beside me, this is Chris Griffiths. Chris is Professor of Public Health at Queen Mary, University of London. Now, air pollution is a major cause of illness and early loss of life, and as such is a major environmental factor that causes health problems in the UK. However, most of the evidence that we have to support this comes from the measurement of outdoor air pollution and our exposure outdoors. And of course, that's not always the case, is it? Because we're sitting indoors today. So David, indoor pollution.
We spend about 80% of our time indoors, and that's split about 50-50 between time spent in the home and then time spent at work or school. Now, we know a lot about outdoor pollution, and we've been studying it for many years, but we don't know quite so much about indoor pollution and the importance of activities that we undertake indoors, like cooking and cleaning, and some of these might be detrimental to our health. So it's important for us to understand the relative importance of outdoor air pollution, how it comes inside, and then the importance of those indoor activities.
So Chris, you're a respiratory physician, so why do we need to investigate indoor air pollution and its potential health effects, especially on children with asthma?
Well, in short, adults and children, particularly people with asthma, experience adverse effects of breathing air indoors. So for example, itchy eyes, runny nose, sleepiness, these kind of symptoms, even wheeziness. We're focusing particularly on people with asthma because asthma is a really common condition in the UK and worldwide, and it particularly affects people from disadvantaged areas as well as people from minoritised ethnic groups. So you may have read in the press recently that outdoor air pollution kills people with asthma. It's a risk for asthma death. In the UK, we don't do very well with asthma death. We've had high rates of asthma death for many years, and we haven't been able to reduce those rates. And finally, the airways of people with asthma are super sensitive to pollution, and so this provides, if you like, a really useful model whereby we can assess how air pollution is affecting people's health.
Thanks, Chris. So Diana, can you tell us what approach we're going to take in the WellHome project?
Well, we know that measuring indoor air pollution can be challenging. People's understandings and awareness of indoor air pollution is low compared to outdoor air pollution. And also, us as researchers ultimately depend on people's willingness to allow us access to that safe personal space which is their home, for us to be able to install monitoring equipment. So here at WellHome, we are following engagement, involvement, and participatory framework. Through our engagement work, we are raising awareness and understandings about indoor air pollution, the causes, the effects, and why it's important what we're doing. Why are we doing WellHome? We also involving the community at every stage of the development of this study, and together co-designing feasible and acceptable methodology. And later, we will be working with them to develop our dissemination strategy. We will be engaging with over 100 homes in the local area for them to actively participate in the gathering of indoor air pollution data. We will focus on the participation of those households from low socioeconomic backgrounds and those households that truly represent the cultural and ethnic background richness of the West London community.
Thank you, Diana. So David, you're our air pollution measurement expert, so what approach are you going to take in WellHome?
We've developed a measurement system that combines small sensors for our standard air pollution species like nitrogen dioxide, PM2.5 and volatile organic compounds. We've combined this with a passive system to measure more volatile organic compounds, bioaerosols and microplastics. And we'll be installing this in the 100 homes. So to give us a representative sample, we're going into these 100 homes in 2 different seasons for 1 month each. But we're going to look in more detail at 10 further homes, which we call priority homes. And in those, we're going to be sampling throughout the entire measurement period, so that's for over a year. And then we'll be dropping in again in 2 further times with more detailed analysis to collect samples for chemical analysis and for biological analysis, and also for toxicological assessment.
Thank you, David. So it's a complicated study. Diana, what do you think we're going to find?
Well, this study will allow us to better understand people's perceptions of indoor air pollution, the sources, the pathways, how they link to health outcomes. We will also be able to identify modifiable behaviors that vulnerable communities can then adopt in order to reduce their exposure to harmful pollutants.
Thank you. And Dave, you're going to take a lot of measurements as you just described. What are you going to discover?
We're going to find out about how outdoor air pollution affects indoor air pollution. We're also going to find out a lot more about indoor activity. I think there's going to be a great deal of variability across the study in that, and we're going to understand how people's cooking habits and cleaning habits affect indoor air quality, and also a lot more about some of the more unusual aspects like mould, microplastics, and some of the cleaning products that we'll pick up. Both those things, I think, will tell us a lot more about how people's exposure varies throughout the day.
Right, thank you, Dave. And Chris, thinking about the health impacts and the findings we may have there.
Well, one of the things that we're particularly interested in is whether the tiny particles that exist in the air and indoors, particles of metals, plastics, mould, these sorts of things, whether these irritate the airways of people, which will increase the risk of asthma attacks. So we'll be doing that in two ways. First of all, we can mix those tiny particles in test tubes with cells that we've harvested from the airways of people with asthma and see whether those cells are irritated by those particles. And secondly, even more directly, we can instill tiny solutions of these particles in the airways, up the noses of people with asthma, and see whether or not those installations irritate the airways of the people with asthma, increasing the chances of them having asthma attacks.
So that's an overview of the WellHome project. I think you can see that it's unique in a number of ways. First of all, we've got this very good community engagement component to the project, which will allow us to really get to know our participants and work with them in the community and get into their homes, be trusted in their homes. Secondly, we have a focus on asthma, particularly childhood asthma, which is a really important issue and one which we know is related to outdoor pollution. So it'll be really interesting to see, how we find any of the indoor signals related to it. Thirdly, you heard from Dave that we have this very comprehensive monitoring campaign in the indoor environment. We're going to be looking at both chemical and biological particles. We're going to be looking at microplastics. I mean, this is going to open up some new areas or avenues of research for us. And then fourthly, of course, we have this toxicological approach, which Chris was telling us about, which will help us really identify key pollutants which may be driving some of those health effects, and hence their sources. And that may then lead to, of course, our ability to come up with suggestions of behavioural changes for those homes. So we hope you enjoyed this overview, and we look forward to seeing you in the breakout rooms. Hopefully, you'll have some questions for us, and we'll be able to tell you some of the more details which we haven't had time for this morning. So thank you very much for listening, and we look forward to meeting you.